Hello everyone, this is Dikshak Bhatt from Team OYG. On behalf of our team, I welcome you all again in another session. Today is the topic of endometriosis, and today we have a wonderful speaker all the way from San Jose, California, Dr. Shreya Soni. Dr. Shreya Soni is a certified in low-dose allergen therapy and intervention nutritional therapy. She is a member of an American Association Naturopathic Physician, California Association of Naturopathic Doctors, and American Academy of Environmental Medicine. Her strong ties to family and cultural tradition have cultivated her to appreciation of the diverse therapies including Ayurveda, Chinese medicine, homeopathic hydrotherapy, and Western medicine. She completed her education in biomedical engineering and clinical homeopathy. She received a doctorate in naturopathic medicine from the Canadian College of Naturopathic Medicine in Toronto and completed her residency at the University of California. She is the founder of website drsony.com, where she helped the people around the globe to live pain-free life from the range of health concerns. She is an excellent painter. Well, besides being a doctor, and in her spare time, she enjoys painting, and she also owns a website for her artwork called shreyapaints.com. I welcome you, ma'am, on behalf of our team and all the listeners and viewers. I hope I haven't missed anything from the introduction.
No, you covered it all. Thanks so much. Thank you for having me. Okay, so we can get started. Do you want to start presenting the slides?
Sure, ma'am. I'll just go through it. Yeah, ma'am. Is the screen is visible?
Yes, it looks great.
Sure.
So if you just, go to present, perfect. Hi, everyone. I'm Dr. Shreya Soni, and I focus in helping women treat endometriosis naturally. Endometriosis is a chronic, debilitating disease, and it's incredible what we can do with naturopathic medicine and help controlling the symptoms and preventing regrowth. So first, I wanted to bust a few myths about girls with endometriosis. You can change the slide. Even if you have endometriosis, you can still get pregnant. I see that with my patients all the time. And even though girls with endometriosis may be suffering from this chronic debilitating pain, I still have so many patients that are successfully running large businesses and extremely successful in both home and work. So even though you may be in pain, I do want to help get rid of that stigma of being in that pain. You're still able to be incredibly productive and successful. And inevitably, these are some of the women that do change the world, because treating endometriosis includes some lifestyle factors like being dairy-free, gluten-free, scanning for environmental toxins in your environment, and starting to use better quality products that don't have environmental toxins. So eliminating things like phthalates, parabens from your soaps. And so that healthy living translates into their environment, makes their families healthier, and it's what leads us to changing the whole world so that we can create an environment that our future generations don't have to deal with some of the consequences of being exposed to environmental toxins, which include hormonal conditions like endometriosis and PCOS. What is endometriosis? So it is a condition in which cells that are only supposed to be within the uterus, so these aberrant cells or even different cell types, they're found on other parts of the body. So it could be the low back, the spine, the diaphragm, even as high as the brain. And what this means is that when a menstrual cycle happens, women are in debilitating pain. These cells do sometimes even release blood. It's a challenging condition because diagnosis requires a surgery and a biopsy of the tissue to confirm endometriosis growth. But you could try an MRI in the middle of your cycle and see if some of those cells bleeding in different locations can be picked up. It is something that is immune mediated, estrogen dependent, and it affects 1 in 10 women, and that number is only on the rise. So some symptoms of endometriosis would be this debilitating pain with when your menstrual cycle starts or during ovulation, incredibly bad PMS symptoms, heavy bleeding, short menstrual cycles, constipation, having a swollen abdomen, often known as endobelly, gas, bloating, difficulty falling asleep, as well as fatigue and exhaustion. You might even have flu-like symptoms during your period. Because of this overlap with so many other conditions, there is often misdiagnosis until you get that endometriosis diagnosis. So one of the most common misdiagnoses on the path to the endometriosis diagnosis is irritable bowel syndrome, or IBS, when it's actually endometrial tissue in the wrong locations causing those symptoms of IBS. So women who have endometriosis are 6 times more likely to have been diagnosed with another condition called pelvic inflammatory disease, and 3.5 times more likely to be diagnosed with irritable bowel syndrome. So again, severe pain and cramping, it's a huge issue in our society. 6.5 million people in the United States and Canada. It can take up to 15 years to get a diagnosis of endometriosis in North America. And this diagnosis, it is more likely when you have a family member with this. So if your mother or sister has been diagnosed, that's one of the ways to clue into, is this affecting me too? There is some blood work at the moment, but nothing to confirm diagnosis of endometriosis. So some of the tests listed here, like looking at hormones, CRP, miRNA tests, they are helpful for managing the condition, but they don't necessarily tell you if you have the condition. So I have plenty of patients with endometriosis who have completely normal CRP levels, but we could look at sex hormones like estrogen and progesterone, especially between day 19 to 21 of the cycle, to see if they are in that condition called estrogen dominance that is impacting this tissue. And we'll be talking more about that in future slides. CA-125 that was listed there, that is an ovarian cancer broad measure. It's not specific to endometriosis yet. So some causes we're going to talk about are genes, hormones, immune, but most importantly, gut and detox. So as naturopathic physicians, that's what we excel in, is in supporting the gut and detox pathways. And it's incredible, some of the success that I've seen with my patients. So for example, one patient, she had to go to the ER 5 times in the fall of last year because of severe endometriosis pain. That's actually a common finding. Oftentimes endometriosis patients are going to the ER during their menstrual cycle because of how much pain it is, because they may faint from the pain. But this year, she had no ER trips and she's had several pain-free periods. So genes, we pull in genetics because oftentimes if your mother or sister is diagnosed with endometriosis, you're also likely to get that diagnosis. Could you go back to that genetic slide? And with genetics, epigenetics are actually even more important than the genes you have. They are getting close to identifying genes that increase your risk of endometriosis, but your environment plays such a huge role in how you express genes that if changing your environment, so removing those endocrine disrupting chemicals from your environment, building healthy lifestyle practices and detox practices, which we're going to talk about, is all going to help you optimize your genetics so that even if you have this family history, you can be healthier than you might have witnessed your mother when she went through endometriosis. You can change this. Yeah, great. So it is possible to check for how you metabolize estrogen. You often do see that endometriosis, there is altered hormone metabolism. So there are tests that will show you if you pick certain pathways that are protective, like 2OH pathway, and we're going to show you a picture of that soon, or other pathways that are proliferative lead to these growths, the 16OH pathway, or pathways that are carcinogenic. So we're about to show you that picture. And the way you can alter this metabolism and optimize metabolism is through liver support, gallbladder support. Yeah, so you can change the slide. Here's the picture I was talking about with the different hormone metabolism pathways. So we do want to maximize the green in the pie chart. That's the 2OH pathway that's protective. Ultimately, estrogen is a really good hormone. It gets a bad reputation in conditions like endometriosis. But I would say it's more the environmental disrupting chemicals like plastics, parabens, and phthalates that act like estrogen mimickers in your body. They're also called xenoestrogens. Those are the greater culprits than actually estrogen itself. Estrogen is a hormone that does rev up the immune system. And in endometriosis, there's a reason that estrogen is out of balance and it's revving up the immune system often. So we often do find some chronic underlying infections that when we help the immune system fight them, you can control your endometriosis symptoms. So some infections that I've supported patients with, Epstein-Barr virus, Lyme, even looking at the gut, sometimes there's often a number of parasites that need to be removed. When you take that load off the immune system, estrogen can come back to normal. So there are some supplements that help women metabolize estrogen better. So pick that green pathway. Some of the supplements here are DIM, indole 3-carbinolol. So those are broccoli seed extract. These cruciferous vegetables are a great source of sulfur and glutathione. And that is directly that red pathway that can, so certain carcinogenic pathways, so the 4OH pathway, that can be improved by using things that are, support your production of glutathione. So one of the big nutrients there is NAC. NAC is something that makes glutathione and is very helpful in endometriosis. And some of the other vitamins here, they do help, like folate, B12, they help you with methylation as well and clearing out the hormones as well. I would prioritize the liver and gallbladder. And if someone is deficient in these nutrients, if someone has genes like MTHFR, and if those nutrients need to be optimized, also supplementing with those for a short period of time. But I wouldn't do methylation support long-term indefinitely. It would just be for a short period of time and then maybe repeated yearly. Okay. So this is another study emphasizing the immune component of endometriosis. Currently, it's not classified as an autoimmune disease, but there is definitely a Th2 immune response component. So the immune system is activated, and that's part of why we suspect that estrogen dominance is playing a role, and this tissue has migrated to different parts of the body. So all of this is hypothesis, not confirmed yet, but these are some studies that confirm this hypothesis, that support this hypothesis. You can go to the next slide. Another slide talking about your immune system. There are two components to it, Th1, Th2, and endometriosis does fall into the Th2 category, which also worm infections fall into, allergies fall into. So it's a bit of an overactive immune response, and we need to calm down the immune response. Okay, you can change the slide. So first step is to manage your inflammatory exposures, get rid of those endocrine disrupting chemicals from your environment. Never microwave plastic. Minimize your use and exposure to plastics. Read the ingredients on your shampoo and conditioners. Make sure you understand each of the words. They should just be plants and water, glycerin, ingredients like that. It shouldn't have any chemicals like PEG 2000. Yeah, so you want to read them, understand it. So same goes for anything you put on your skin. When things are put on your skin, like perfumes, creams, they go right into your bloodstream and they can act like hormone disruptors. So when something is on your skin, it gets to the liver later, versus if you eat some of these hormone disruptors, your liver has a chance to metabolize them before it goes into your bloodstream. So you need to be even more picky with products on your skin. And as much as possible, try not to buy products. You can use some of the oils in your kitchen, coconut oil, avocado oil, olive oil. as moisturizers, lubricants as needed. So try to go as natural as possible. You do want to make sure you have a healthy gut. So eating warm, well-cooked foods is really important at helping your gut heal. So oftentimes people who are trying to be too healthy, they eat a lot of salad. That's kind of the opposite that you want to do with something like endometriosis. The reason is that salad has a lot of raw food that your body has to do extra work to cook and metabolize. So if you are having a salad, you want to use dressings on it, things like apple cider vinegar, olive oil. You also want to do it during the daytime when your metabolism is the strongest. You don't want to be eating a lot of raw food at night. The other thing is that oftentimes with raw food, there can be other bacteria. So if something's like a romaine lettuce, your gut has to work harder to kill it, versus when something is pressure cooked in a pot, all of those bacteria have had a chance to be killed. So that's why eating warm, well-cooked food. There's another myth that people should be vegetarian with endometriosis. That's not necessarily true. It is person to person. Some people that helps, other people it wreaks more havoc, because there are certain nutrients you can only get in meat. For example, B12 is really hard to get if you're not eating meat. And some women have a genetic predisposition to having low iron levels. And for them, keeping out meat can cause more harm. So I talked earlier about some of the key supplements on the slide. NAC, which is so important for liver support, liver gallbladder support, followed by some of these pain relieving nutrients like melatonin, green tea, resveratrol. I'll add that I don't really need to use these pain relieving supplements like resveratrol, melatonin, pycnogenol with patients, because we can accomplish so much just by working on the liver and gallbladder that they can get to pain-free cycles by dealing with the cause. They don't end up needing more anti-inflammatory support. You can go to the next slide. So NAC is that one of my top recommendations in endometriosis. There's a high dose recommended, about 1,800 milligrams. It is possible to take too much NAC, so you do want to work with a practitioner who understands how to use high dose vitamins, and you don't want to self-medicate, but this would definitely be at the top of the list. So studies have shown that it has reduced the size of lesions, reduced the need for surgery, increased the amount of pregnancies that occur, as well as lowered pain. So specifically, you will see there's a study there showing ovarian endometrioma came down with NAC. All right, so here is another long list of supplements. I don't want anyone taking supplements by themselves again. I do want you to work with your doctor, because it is possible to take too much of all of these vitamins. So for example, vitamin D, you can get to toxic levels by taking too much, but more often than not, especially looking at South Asian populations, we are way too deficient. So getting that test run on your vitamin D levels is going to be helpful for dosage. So some patients might need even 10,000 international units a day for a month, and then you can go down to maintenance doses of vitamin D. But vitamin D regulates your immune system, and so it is close to the top of the list for endometriosis. NAC is at the top of the list, and the others are part of general wellness, but not targeted treatment. So I would do more liver gallbladder support. Something like a castor oil pack can be quite helpful. Castor oil is an herb that it's brown, dark colored. It is relaxing. It supports the parasympathetic nervous system. That's the nervous system that's responsible for relaxing you. And it can support the flow of bile through the liver and gallbladder. So you can apply that on your right upper quadrant and allow for bile flow to help support detox in the liver gallbladder. But even that needs to be done with a naturopathic doctor, because if you leave it on too long, then there might be gallbladder contractions, and that could be an urgent or emergency room situation. So you do want to first work with a practitioner. You can change the slide. These are some just images from my website and my Instagram page. So to summarize some of the causes of endometriosis, research has shown past history of infections increase endometriosis rates. there is inflammation happening. Past trauma can increase the chances of an endometriosis diagnosis. So that, for example, childhood trauma, and it's more whether you as a child perceived it to be trauma. So even if other people think what happened in your childhood, wasn't a big deal, if you felt scared or threatened, that counts. And so trauma can cause chronic stress, which can be part of why there is inflammation. Because the same thing that is stressful to me may not be stressful to the other person. So it is your perception. And then environmental toxins are definitely part of why. We like to blame genetics and our genes, but the reasons why we have certain genes, they're passed down, but their expression is modulated by your exposure to environmental toxins. So it could have even been in utero. So you were exposed to those toxins while you were a baby, and that led to higher risk of later on developing things like PCOS, endometriosis. So it is possible to heal from the cause. There are surgical options for endometriosis as well. You do want to avoid ablation if you can. Ablation is more likely to leave scarring, and opt for the wide angle excision surgery. But it's important to still treat it naturopathically, because even if you've had the surgery, it doesn't mean that the tissue is not going to grow back. And so dealing with the cause naturopathically is extremely important. And getting a surgery at least once can be helpful as well in cutting out the tissue that is the issue. And again, the key word is cutting out, the wide angle excision surgery, not so avoiding ablation. That's when they go in and burn the tissue where they find it. You can change the side. Okay, and we've briefly talked already about nutrition. The main things for anyone with endometriosis, it is important to keep out dairy. Dairy has growth hormone in it, and especially in the United States, our quality of dairy is quite poor. We have different cows. So I know for vegetarians, keeping out dairy can be hard, but it is worth a trial of 1 to 3 months and working on getting in protein otherwise through lentils or other plant-based options. So definitely try to keep out dairy for 1 to 3 months and see if that calms down your endometriosis symptoms. Other than that, having a diet that's rich in omega-3s, fiber supports the liver detox pathways. You have to be gentle with your fiber intake. It can cause more bloating if you do a lot of fiber powders all at once. You want to switch to eating organic because you're going to be exposed to less pesticides. Pesticides are another endocrine disrupting chemicals. They affect fertility because that's the nature. The reason they're used is to be able to kill insects and throw off hormone pathways. That's how pesticides work, and the more you can restrict your exposure to them, the better. You do want to incorporate some antioxidant superfoods that would help you deal with oxidative stress of environmental toxins like air pollution. So some of the superfoods would be goji berries, pomegranates, matcha can be really great. Prebiotic and probiotic foods will help you have a good microbiome. Some people can't handle prebiotic and probiotic foods, and then we need to do an investigation into their gut and look for any types of overgrowths or imbalances to treat before they are able to tolerate it. So some women with endometriosis may get more bloated with prebiotic and probiotic foods. And then definitely restricting trans fat, refined sugar, caffeine, and alcohol. I often find that patients are already doing this because endometriosis is so painful. All right, so environmental toxins. We've talked about this throughout the presentation. BPA is found in plastics, dioxins, they're industrial byproduct. PCBs, they're actually in some types of floss like Glide, the slippery Glide floss. Pesticides, heavy metals, those are all associated with a high risk of endometriosis. So if you want to deal with the cause, you want to start to keep those out and then support your liver and gallbladder detox. Yeah, those are, again, a list of areas to look for environmental options and start to make the change. It's not possible to do all of this overnight. It's going to take several years, and you're going to learn quite a lot on the way, but it's important to start making the change. And if anyone wants to pause the slide and take notes on that, you definitely can. Here's another piece about infections in endometriosis. I do want to get the immune system in great shape. So anytime I see signs of chronic infections in patients, we do investigate it further. And so I am often looking at the tongue. That tells me a lot about the digestive health and the need for something like a stool test to look at any parasites, candida, yeast, bacterial overgrowths. You can change the slide. On my website, I do have a blog on helping deal with trauma when it comes to endometriosis. So when you have a disease like endometriosis, it helps you create a lifestyle that prioritizes your health. So it makes you make time for things like acupuncture, massage, and helps you put yourself over any other needs. And so once you are pain-free, this purpose of the blog is to help you keep up those lifestyle habits that are really important to preventing the disease growing back. So take a look at that blog if you feel like trauma might be part of why this condition developed. I have some patients that can tell me exactly the incident and the guilt associated, after which the endometriosis really became an issue for them. So if ever some experience feels like it just happened yesterday when it actually happened 2 years ago, that's how you know if there's something to heal. Homeopathy can also be really helpful in clearing out some of the stuck emotions with past trauma. Some of my top remedies with endometriosis patients, arnica has that sore, bruised sensation. So pre-post surgery, I'm often using arnica for endometriosis patients. Staphysagria has a cutting sensation as well as anger associated. So this also might be used pre-post surgery. Sepia is another great hormonal homeopathic remedy. And sepia it sometimes has to do with just difficulty with the patriarchy. So if you're really angry about that, it also has a sensation of heavy legs during the menstrual cycle. So that's kind of an explanation of how homeopathy might fit in opening the pathways to healing for endometriosis. That's another list of adjunctive care. So we've talked about quite a few of these already. Oftentimes, women with endometriosis, when they go through the conventional system of medicine, the options are given are birth control or medications to stop their hormones for months and put them into menopause early. Those don't deal with the cause. I do have patients on birth control who still have worsening endometriosis. I have patients with IUD who tried IUD Mirenas, but it actually made the endometriosis worse. So some people, these options do work for a period of time. There's a role for them, but they aren't dealing with why you have the endometriosis. And if it's a birth control that puts in external hormones, that actually is making it even harder on your liver and gallbladder because it now also has to metabolize those external hormones. But along your path to healing, acupuncture, pelvic physiotherapy are all good options. All right, so I have some contact information for myself. If you have additional questions, I practice in San Jose, and that's my website, dr.soni, S-O-N for Nancy, I for India.com. That's the clinic phone number there, and my Instagram handle, theEndoDoc. All right, you can change the slide. I think that's the end of the presentation. Well, thanks so much for joining us. I hope that was helpful for all the practitioners working with endometriosis. Again, it's a condition that is possible to make a lot of headway on and make a lot of progress on. I see it all the time. And if you have any questions, you can reach out to me.
Thank you so much, ma'am. It was a wonderful session and it was much informative sessions on the topic. We would glad that you cover all the topics and each and everything about the endometriosis, and it was a really a nice session. Even I myself learned a lot from this session. Ma'am, can you share any your experiences about with your patients?
Yeah, of course. So I have patients that come to me at all stages of endometriosis. Some are in perimenopause, some are young girls just diagnosed, and others are, at the stage of trying to get pregnant. And there's a role for naturopathic medicine in all of those. With some of the treatments I've mentioned, liver gallbladder support, oftentimes it's their next menstrual cycle after starting the treatments, they already start to feel better. So naturopathic treatment is very helpful, very effective. You can see it at the very outset. When I talk about liver gallbladder support, there's a lot of herbs and vitamins we can use. So bitter herbs are really great to support the liver. There's a food, sunflower lecithin helps the flow of bile. NAC is really great. And yeah, if there is a gallbladder bile issue, you can examine their abdomen and find that out by checking the right upper quadrant of the abdomen. Yeah.
That's great, ma'am. You have given us such information, which is such a helpful for us, and we will try to practice as you guided us. Ma'am, how do you build your rapport with your patients?
How do I build my rapport with my patients? So I get to spend an hour with patients, which is quite a bit of time in the medical system here in the United States. And so I let the patient lead and tell me their journey. And so that is how we start. So the patient is, um, they're the ones who know their disease the best. So they're definitely there taking the lead. And that's one of the ways I build my rapport, is creating a space where they can be listened to and heard, and staying curious, because all the patients I see, they all have differences in the endometriosis. It's not the same. So it is patient specific.
All right, ma'am. We know that there are so many researches available in this, and day by day new researches come up. So how do you keep yourself up with the new researches? Because as being a doctor, it is a hard job. Even myself, I'm trying, but I cannot cope up with this all information. So how do you deal with that? Because you have a successful career, so you can guide us on that.
Yeah, great question. I have a whole collection of books that are on my to-do list to read. I don't think it's ever possible to be totally caught up with everything. What you can do is surround yourself with like-minded people. So I have some great friends, both naturopathic doctors and even patients with endometriosis or women with endometriosis. And they're always saying, hey, have you looked at this article? Look at this new gene they're studying in endometriosis. So that's a very engaging way for me to stay on top of the latest information, um, having good community in place.
One question is from my side is how do you connect it with the naturopathy? What inspired you? What is that spark that guide you towards the naturopathy?
Yeah, I was always interested in healthcare. That's why I studied biomedical engineering in undergraduate. But I did notice that when we were looking at solutions to chronic health problems, so for example, heart disease is one of the top killers in the United States. The way we would pursue a solution is if you could patent it. So intellectual property rights dictate what is investigated as a treatment as a result. And so you're seeing pharmaceuticals and surgical options having much more research on them than some of these natural lifestyle treatments that can't be patented. And as a result, what ends up being taught a lot in conventional medical schools will be the items with the higher amount of research, which is the pharmaceuticals and the medical devices. And to me, growing up in India, so I was born there, I saw how effective naturopathic medicine was from the outset. My grandfather would use homeopathy first. Um, so my family always had this practice, and I'd seen it work. And to me, it was the missing piece in the US healthcare system. So we do spend the most on each person, but we rank the lowest among developed countries in quite a few aspects. So in the list of 30 developed countries, we would be 30th on the list, especially when it comes to maternal mortality, for example. So in the rest of the world, other countries are getting better every day at reducing maternal mortality. The US is the only country where it's getting worse. And people will tell you it's not because of a lack of emergency medicine. We're great at emergency medicine. It's because of this missing piece of preventative healthcare. And so that's why it was so important for me to get an education where the emphasis is on nutrition, lifestyle, herbs, as there is still education on pharmaceuticals and the standard of care of how to practice. But I definitely wanted the focus to be on how to deal with the cause and have a mindset of it's not enough to suppress the symptoms or deal with the symptoms. We have to deal with why the symptoms were there in the first place. And that's what I found in naturopathic medicine.
That was really a great. And last question from my side, ma'am, do you have anything suggestions or tips for the us aspiring doctors who are listening or watching us right now? So do you have anything tips or suggestion for us?
Yeah, I'd say remember why you joined naturopathic medicine. It is really wonderful being in practice. So look forward to post graduation as well. There is so much opportunity for growth. And we know that a lot of the healthcare issues, heart disease, cancer, naturopathic medicine can be incredibly helpful with dealing with the cause. So you're very much needed in society. And I'm excited to see what this next generation of naturopathic doctors will do. There's a lot of room for innovation. Naturopathy is so different where it's practiced, India versus the US versus Germany versus France. So I think what you're doing with collaborating with different people from around the world is a great way to approach it. And yeah, it's a new system of healthcare. I'm excited to see what we can do for the population.
Thank you so much, ma'am, for your lovely guidance and lovely time. You gave us so much of information about the topic, and we glad that we could connect you in the future. Also, we are glad that you connected this time and gave your time and valuable time to us. We all are, very much thankful for that. Hope to see you again in future, and I hope we can connect in person as well, because right now the COVID situation, so we are just doing this online session and everything, but we hope to see you in future and have a guiding sessions again with us, all of us. Thank you so
Course,
much, ma'am.
yeah, I'm going to try to go to India this year. Currently, the you're not allowed if you have a tourist visa, and that's what I have. So hopefully some of those things lighten up, and then definitely we can all
Ma'am,
meet
we,
in
we
person.
would love to help you in that. If you have anything needed to help with us, we are ready to help you anytime.
Thank you so much. I appreciate it.
Thank you so much, ma'am, for connecting with us.
It's a pleasure. Have a great rest of your day.